Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about fascial nerves. Here's the outline. Definition, anatomic landmarks, general light, extracranial view, root in the middle ear, fascial canal anatomy, intracranial branches, extracranial branches, nuclei, brachiomotor, salivatory, trigeminal, and solitary. And then fascial nerve proper, greater petrosal nerve, deep petrosal nerve, chorda tympani, and lesser petrosal nerve. What is the fascial nerve? The fascial nerve is the seventh nerve, cranial nerve, or simply cranial nerve number 7. It emerges from the pond of the brainstem in an area posterior to abducens nerve 6 and anterior to vestibulocochlear nerve 8. It controls the muscle of facial expression and function in the convergence of taste sensation from the anterior 2/3 of the tongue. The nerve typically travels from the pond through the fascial canal in the temporal bone and exit the skull at the stylomastoid foramen. The fascial nerve also supplies preganglionic parasympathetic fiber to head and neck. The nerve typically travels from the pond through the fascial canal in the temporal bone and exit from the skull at the stylomastoid foramen. Here are the anatomical landmarks that allow you to follow the path of this nerve. This is the general outline. The fascial canal, also known as the fallopian canal, it is a Z-shaped canal running through the temporal bone from the internal acoustic meatus to the stylomastoid foramen. It is approximately 3 centimeters long, which make it the longest human osseous canal of the nerve. It is located within the middle ear region. According to its shape, it is divided into 3 main segments: the labyrinth segment, the tympanic segment, and the mastoid segment. It contains the 7 cranial nerve, known as fascial nerve. From endocranial view, is the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The internal auditory meatus connecting the middle ear with the occiput through the petrous part of temporal bone. Internal auditory meatus connecting the brainstem to the middle ear through the petrous part of temporal bone. We need also to know the root of the nerve inside of the middle ear. Here's the middle ear. with the floor, the roof, the anterior wall, and the posterior wall. And here is the medial wall. From the we recognize the promontory with the round window and oval window. From the posterior wall, we recognize the adductus and pyramid. And from the anterior wall, we recognize the Eustachian tube. Most importantly is the promontory. From the endocranial view, you can recognize the fascial nerve with the vestibulocochlear nerve. They are going from the bulb to the middle ear. On the other side, we recognize the glossophagean, the vagus nerve, and the accessory nerve. From sagittal view, there is anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. We recognize the middle ear and the pterygopalatine fossa. Between the middle ear and pterygopalatine fossa, there is foramen lacerum and foramen ovale. From the cranial view, we recognize the internal acoustic meatus connecting the brainstem to the middle ear, and from the anterior, we recognize the Eustachian tube. Here is the foramen lacerum and near the foramen ovale. The middle ear, of course, and the inner ear with the vestibula and cochlea. After having made an overview of the different anatomical landmarks, let us see now the nuclei at the region of different branches of the nerve. There are 4 nuclei for facial nerve: the brachiomotor, the lacrimosalivatory nucleus, the trigeminal spinal nucleus, and the nucleus solitarius. 4 nuclei that connect viscera. There is efferent fiber and afferent fiber. Efferent fiber is VE, coming from the brachiomotor nucleus to muscle of facial expression. GVE, coming from the lacrimosalivatory nucleus through GVE to lacrimal gland. And there are efferent fiber coming from the external air for touch, pain, and temperature through GVA to the spinal trigeminal nucleus. And from the two-third anterior thong tests are going to the nucleus solitarius through SVA fiber. 2 efferents, SVA and GVA, from brachiomotor to muscle of facial expression, and from lacrimotor salivatory, superior salivatory nucleus to the lacrimal gland. Afferent fiber coming from the external air and from the two-thirds of the tongue, from the external going to GVA to the trigeminal spinal nucleus, and from the third anterior tongue for test to solitary nucleus through SVA fiber. 4 nuclei. We start with the brachiomotor nucleus, and then the superior salivatory nucleus, which has two parts. The upper part is lacrimal, and the lower part is salivatory. Then there is the trigeminal nucleus, and then the solitary nucleus for test. Notice the proximity of the nucleus of the brachial nucleus motor with of fascial nerve propre with the nucleus of abducens. Here is the nucleus of abducens. Here is the nucleus, the brachial motor nucleus of fascial propre. There is a proximity between them. Another view to illustrate the fascial propre, the nerves intermedius or nerve of Urinsberg nerve. Both of them, they go to the internal auditory meatus with the vestibulocochlear nerve. This picture is to understand the anatomy of the internal auditory meatus. Inside the internal auditory canal, the position of nerve are fascial nerves is 7, and the cochlear nerve here, and superior vestibular nerve is here, and inferior vestibular nerve is here. Notice the position of fascial nerve, it's 7 up, and cochlear is here, like coca. The falciform crest is an horizontal ridge that divides the lateral portion of the internal acoustic meatus into superior and inferior portion. Falciform crest. On the other hand, Barr is a bony anatomic landmark that divides the superior compartment of the internal acoustic meatus in anterior and posterior. Barr to divide the posterior and the anterior. Falciform crest to divide the superior and the inferior. Here is to understand 6 segments: the intracranial segment, the meatal segment, the labyrinthic segment, the tympanic segment, and the mastoid segment. The last one is the extratemporal segment. I repeat, intracranial and the meatal segment, labyrinthic segment, tympanic segment, mastoid segment, and extratemporal segment. Another way to illustrate the anterior cranial fossa, the middle cranial fossa, the posterior cranial fossa, the temporal bone, and the petrous part of temporal bone. From this petrous part of temporal bone, there is internal auditory canal that come in from the brainstem to the middle ear, especially to the geniculate ganglion, and the fascial nerve is describing a genu inside the geniculate ganglion going to the middle ear, to the posterior part of the middle ear, and from geniculate ganglion there is fiber coming to the foramen lacerum as greater petrosal nerve before they go to the pterygopalatine fossa. What are the intracranial branch of fascial nerve? There is the greater petrosal nerve, and there is the nerve for stapedius, providing the stapedial muscle, and chorda tympani. Distal from the styloid foramen. The following nerve branch of the facial nerve are posterior auricular branch to the muscle around the ear, branch for the posterior belly of the gastric, and branch for the styloid muscle. There are 5 major facial branches in parotid gland. From the top to the bottom, there is the temporal branch, the zygomatic branch, the buccal branch, the marginal mandibular branch, and cervical branch. I repeat, from the fascial proper coming from the internal auditory meatus to the geniculate ganglion. From geniculate ganglion is going through the fascial canal to the styloid foramen, and extracranial branch from styloid foramen are posterior auricular nerve, muscle around the ear, branch posterior for the belly of the gastric, and branch for styloid muscle. 5 major fascial branches in parotid gland. From the top to the bottom, there is temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. Stapedius muscle inside the pyramid is attached to the neck of stapes. When there is a loud sound, stapedius muscle contracts, causing the tilt the foot plate of stapes to restrict the movement, preventing the inner ear from excessive stimulation. It's a protective reflex for hair cell. The muscle contracts also when a person talks, to avoid to hear much from himself. The greater petrosal nerve. The greater petrosal nerve is a nerve that branches from the fascial nerve. It forms part of a chain of nerve that innervates the lacrimal gland. The preganglionic fiber, parasympathetic fiber, axon of this nerve synapse in the pterygopalatine ganglion. Fiber coming from the superior salivary nucleus to geniculate ganglion. They do not synapse in the geniculate ganglion. They go to the pterygopalatine ganglion to synapse there, giving secretory motor fiber, preganglionic parasympathetic fiber to the ocular gland, nasal, paranasal, mucosal gland, and to buccal and nasopharynx. There are some landmarks that are necessary to understand the greater petrosal nerve. The first one is the superior salivary nucleus, then the internal acoustic meatus, the geniculate ganglion, the foramen lacerum, and the pterygopalatine fossa. Between foramen lacerum and pterygopalatine fossa, there is a canal. The canal is the canal of it's called pterygoid canal. I repeat this landmark: superior salivatory nucleus, internal acoustic meatus to geniculate ganglion, foramen lacerum, pterygopalatine fossa. Between foramen lacerum and pterygopalatine fossa, there is the pterygoid canal. Preganglionic fiber coming to the geniculate ganglion. Some fiber go to the fascial proper. Some of them ascend to the medial cranial fossa to jump into foramen lacerum. They are accompanied by some test fiber inside the bony tunnel of petrous part of temporal bone to emerge in the medial cranial fossa to approach foramen lacerum. From sympathetic plexus coming from carotid artery, internal carotid artery, there is sympathetic fiber coming to connect as deep petrosal nerve. Fiber coming from the deep petrosal nerve, they fuse with fiber coming from preganglionic parasympathetic fiber, and together they make the nerve of pterygoid canal. To understand, there is a common carotid artery, there is left external carotid artery and left internal carotid artery. Between them, there is carotid sinus. Inside the middle cranial fossa, there is carotid canal and foramen lacerum. Between C2 and C3, it's foramen lacerum. Between C2 and C1 is canal carotid. And over C3 to C4 is cavernous sinus. At the level of T1 and T2, sympathetic fiber going through the superior ganglion, postsynaptic superior ganglion of cervical chain. From the superior ganglion of cervical chain, postsynaptic sympathetic fiber go to the internal carotid artery, and from the plexus of internal carotid artery, sympathetic fiber, they go to the foramen lacerum to form the deep petrosal nerve, which fuse with preganglionic parasympathetic fiber coming from the greater petrosal nerve. Both of them, they constitute the VII nerve to go to pterygopalatine ganglion. Another way to illustrate preganglionic parasympathetic fiber coming from the geniculate ganglion as greater petrosal nerve to the foramen lacerum, and the sympathetic postganglionic fiber coming from the carotid plexus are going to the same foramen lacerum to form the lesser petrosal nerve that send fiber that fuse with the greater petrosal nerve to form the nerve of pterygopalatine canal or VII nerve.